Human Services Committee meeting Wednesday, September 6, 2023, to come to an order. Let's all rise and say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Amen.
Thank you. We're going to move on to number 3 on the agenda, public comment. We have 10 people that would like to speak. Please keep the topic to our agenda items. And if there is somebody that says the same thing that you're going to say, you can pass if you would like. We're going to first start with Christine Salm. And you can come up to the microphone. Up here. And we'll need your address also. We don't have to say that, okay? Just your name then. We are giving 3 minutes per person.
Good afternoon.
And I'm going to have Kim go ahead and time for me. So, go ahead.
Ready? All right. The time it takes for the county board to address certain board members' fringe-based theories is a waste of taxpayer time and money. And again, it's not going to change anything because the county health officer doesn't have enforcement powers. So this proposed resolution doesn't change anything. Marathon County Health Department gets its guidance from the state. Masks work, period. Peer-reviewed.
We do need decorum in the meeting.
Peer-reviewed studies support this. My background in surgery and healthcare supports this. And
I'm
the
asking
death
for
toll-
decorum.
Yeah, the death toll from COVID misinformation, like the misinformation presented in this resolution, is now clearly documented and is undeniably horrific. Stevie Berryman sums it up nicely and says, one of the most dangerous ideas that has come about in the last 3 years is that all points of view are equally valid and that you, the average citizen, are just as equipped to judge which have merit as anyone else. Hear all sides and judge for yourself. No, I don't condone the death of expertise, and neither should you. I am an expert in very few things, but in those areas, my expertise is hard-earned through study, work, experience, and aptitude. None of it comes from attending Google University. But unless you are an expert in exactly the same areas, your opinion is not just as valid as mine. It's not. And my opinion is not as valid as the experts in their field. That is why they are the experts. So if our leading epidemiologists largely agree that A is correct, and a couple of discredited doctors on YouTube say B is correct, our response should not be, I'll listen to both sides and decide what makes most sense to me. Confirmation bias exists. It's real, and none of us are free from it. To paraphrase Asimov, your ignorance is not the same as their experience. Genuinely smart people look for answers from people who are smarter than themselves. This resolution, steeped in COVID misinformation and conspiracy theories, is nothing more than political theater, and it prevents this board from doing the important work of running this county. Let the experts do their job and stop wasting the board's time and resources on junk science and your personal agendas. Thank you.
Thank you. We'll abstain from clapping after comments. The next one is Dan Joling.
Dan Joling, 2400 North Road, Colonel Wetter. I don't have the background the gal in front of me had, but I do know that I'm strongly opposed or in favor of the opposition for COVID. I now, over these last 3 years, have witnessed the amount of deaths from COVID treatments and protocol. We have a number of family members that have suffered and are still suffering, of which the alleged experts will always say to them they have no idea where and why and how come. I've seen the Anthem Blue Cross paper that talks about stipend payments to the medical profession. And the biggest question in my mind is why the homeless population has not been completely decimated. I look at the AMA and where the AMA came from, how it was created, John D. Rockefeller. And fear equals nothing more than control. Also, whatever title you put on it, but especially if you put on the title, of a mandate. In civil law, this refers to the written command given by a principal to an agent. It is a commission or contract by which one person, the mandator, requests somebody, the mandatory, to perform some service gratuitously. The commission becomes effective when the mandatory agrees. In other words, the party should voluntarily intend to enter into the contract. If this would go forward, I can only speak for myself, and I'm going to take the privilege of speaking for my wife. We're not going to comply. Thank you.
Again, I do ask that we do not clap after comments. All right, the next person is Eileen Eckert.
As tall as the previous people, I think. Thank you for allowing me the opportunity to speak today to the board. My name is Eileen Eckert, and I'm a registered nurse with a lot of experience in adult, pediatric, and maternal child health, as well as public health. I'm here to provide some commentary on the COVID-19 resolution that's brought forth to this board. My first question is, does it apply to only COVID? COVID is not the first pandemic we've had and certainly won't be the last. And the second question I have is some parts of the resolution have opinion in them instead of fact. So a resolution by its nature needs to be based on fact. So that's a flaw in the resolution. The third paragraph says that masking may not have any demonstrable effect on the transmission of airborne viruses. This is an untrue statement. Studies definitely show the effectiveness of masks. The information in the packet are presented as facts, but they are not high-quality, replicable studies and are not seen as reliable. Are masks perfect? No. It depends on the wearer using the right mask at the right time and in the right environment. You can bet that when I worked in public health and needed to go to someone's home who had infectious TB, I wore my fit-tested N95 mask to prevent my exposure. We talk about freedom. Freedom would include my mother, who was in a nursing home, to be free of infectious disease provided by the workers who may not be complying with best practice in reducing their exposure to COVID. So we can have further discussion about freedom in that area if you'd like. For the record, Marathon County has not had a vaccine mandate. It's been advised, it's been recommended. Your employer, your school, your community group may have required it, but it was not required by Marathon County. The fun fact is the health officer of Marathon County has not been given enforcement powers because there's not been an ordinance passed in our county. So any mandate, when people are all up in arms about a mandate, she doesn't have the power to enforce that. So given that, this whole thing could just stop because she doesn't have the enforcement to mandate anything. She can make advisories upon the recommendation of what the state recommends for us, but she does not have enforcement powers. So as a resident of Marathon County, you can already choose what your response would be to an infectious disease situation. There, again, are not any mandates. This resolution does nothing to change that. And it's a waste, I believe, of resident and board members' time. I'm confident our board members have other more important work to do rather than enter into this unnecessary and frivolous resolution. Thank you.
Thank you, Eileen. Next is Renee Radcliffe.
My name is Renee Radcliffe. I am speaking in favor of this resolution. A couple of things, everyone.
Go closer to the mic here.
I'm speaking in favor of this resolution. I understand that at the current time, the powers that be do not have the ability to enforce any mandate. As I see it, this is a prevention in allowing that to happen in the future. If we look back at what the experts told us at the beginning of this, I remember the playground across from my house being taped off with police tape. There were considerations of people who were contact traced or positive for the COVID test being considered to have ankle bracelets and police officers placed out. These were all things that were talked about in Marathon County. And they were looking for ways to enforce those things. I understand that this is a disease that can definitely kill people. However, the people have the right to decide if they need to wear a mask, if they need to be vaccinated with a vaccine that is only 2 years old, has no long-term studies as to its long-term effects on anyone. And if anyone is going to try and tell me that the experts know that this vaccine is going to be safe 10 years from now, we need to look back at all the other things that we have been told are good for us. And now 10 years later, if you watch the news or watch any TV program, there's lawyers suing about the side effects from all kinds of things. So don't tell me that the experts know that this vaccine is safe after only 2 years in use and that we should be open to the consideration of being mandated to receive this vaccine. So these are all things to consider. I look at this as a prevention of overreach of power. If you are afraid of the vaccine, or afraid of the disease, wear the mask, get the vaccine, and take precautions to protect yourself. Kindergartners and first graders coming out of a public school should not have masks all over their face because of something like this mandated by the county. Thank you.
Thank you. Please refrain from clapping. All right. I feel like I'm talking to my children. All right, Scott Baer.
My name is Scott Bayer. I'm just going to elaborate on what Renee just said. I agree with everything that she said. There's a few more other topics, though. If we actually honestly think and look at what's happened in the last 3-4 years and what this country has gone through and what they've done, there are no facts. Everybody in this room, what they told us, half of the people I know should be dead. That's what they told us. I don't believe any of it. I've had doctors, medical doctors, tell me that the masks do not work. You're dealing with a particle smaller than oxygen. So if you're breathing oxygen through your mask, that particle's coming through. Again, there's all these other treatments out there that did not allow us to do that. And what they're doing is, again, talking about the kindergartners, communists, train those kids right from the get-go. Wear a mask, don't question it. You were told to do that, you do it. That's not democracy, that's not America. I have 3 friends that died in the last 3 years. I have one friend that is in a huge medical condition because he had a heart condition and his doctor advised him to take this vaccine. Worst mistake he ever made in his life. My one friend in Iowa died from a tractor rollover. They hauled him to the hospital, called it COVID. Don't tell me that the numbers are true. That poor family, because they called it COVID, no medical expenses, nothing, no insurance would cover that at all. I don't believe in it. Yes, there is a disease. There's also flu out there that kills just as many people. This is a political warfare. I'm not saying there's not a disease out there. If you feel comfortable of getting the vaccine and wearing a mask and thinking that protects yourself, go ahead and do that. I work in the livestock industry. I know about vaccines. I've been educated. I know how they work. This is not one of them. That's all I have to say. Thank you.
Thank you. All right, can we just do thumbs up instead of clapping? Next one is Matthew Bayer.
I don't have anything to add.
Thank you, Matthew.
I agree with the last two people.
Thank you. Next one would be John Potter.
Yes. Could you help me out, please?
We could hand a microphone to you.
Okay, whatever works best for you.
She's giving you the microphone.
Thank you. I would like to thank the board for hosting this event, and I would like to thank the board for allowing public comments. My name is John Potter. I am from Camp Creek Road in the town of Texas. I fully support the resolution, and the resolution and I have one very important thing in common, and that's common sense. And I ask everybody, where were you before the pandemic hit, and what were you doing? I moved to Wausau 9 years ago. I'm from Waukesha. When I moved to Wausau, there was peace, there was harmony. I don't care if you were a Democrat or Republican or a liberal or agnostic or what your faith was, people got along. Now, I said to myself, what is going on here? And I am extremely depressed about how this has been handled in terms of the mask mandate, the poison shot, and most importantly, the lack of common sense. So I'm here to tell each and every one of you, let's put common sense in the equation. Let's support the resolution. Let's bring back the great city of Wausau, the wonderful county of Marathon, and the great state of Wisconsin to what it was before this pandemic discombobulated all of us. Thank you, and God bless you.
Thank you, John. I just found out that I can threaten to clear the room if need be and bang the gavel for those clapping. So could we refrain from that, please? Thank you. Tom Schutte, you are next.
My name is Tom Schutte. It has been well documented that government
A little closer. There you go.
It has been well documented that government agencies at all levels failed with COVID-19, resulting in tremendous harm. People open to the truth and who seek the truth know this. It would be refreshing if these government agencies would own up to their mistakes, learn from them, but unfortunately their response has been to double down with the same failed practices. This resolution makes perfect sense to me. I support it and urge you to support it. It's hard for me to imagine that anyone would still have blind trust in these government agencies. A well-known proverb is applicable here. Fool me once, shame on you. Fool me twice, shame on me. Thank you.
Thank you, Tom. Christopher Wood.
Hello, my name is Christopher Wood. Thank you all so much, brothers and sisters, for attending. I really want to thank the county board for continuing to stand up for everybody. It takes a lot of sacrifice of your reputation and possibly livelihood in your day-to-day to put in the energy and effort to stand up for what's right, so God bless you. I'm going to go through and talk a little bit about things that people may not know. I think a lot of people are well aware that COVID is a scam. Well, you know, the whole practice of it. Everyone understands there's disease, but the fear that they've pushed is to such a great extent to try to control and manipulate us. So I'm going to talk about who's actually behind it, because not too many people want to do that. You know, we always talk about Republicans, Democrats, but they're both wings of the same bird, unfortunately. So the COVID agenda, who was in charge of the CDC that was controlling and telling our government to shut down small businesses and what they recommend for the mandates of the vaccines and Pfizer and all this? Ooh. So at the time when COVID was being enacted, I'm going to read off the staff of who was in charge of this CDC. The director of the CDC was Rochelle Walensky, dual citizenship with Israel. She's a Jew. Deputy director of the CDC, Ann Shawalchik, dual citizenship with Israel, Jew. CDC chief of staff, Sherry Berger, dual citizenship with Israel, Jew. CDC chief medical officer, Mitchell Wolf, dual citizenship with Israel, Jew.
Chris,
CDC director of the
Chris,
Washington office.
I'm gonna
This
ask that
is
you-
pertinent to the topic. We're
This
talking
is-
about COVID, right?
Freedom of speech. Let them
Yeah,
speak.
this is pertinent to COVID, so
Just because
I love you,
he's Jewish
Jennifer.
doesn't make it bad. Let them speak.
Yeah, please. So director of the CDC of the Washington office, Jeff Resnick, dual citizenship with Israel, Jew. COVID czar, Jeff Zaints, dual citizenship with Israel, Jew. COVID senior advisor, Andy Slavitt, dual citizenship with Israel, Jew. Assistant of Health Secretary for
This
Human
is out of
Services for
order.
our country, the Assistant of Health Secretary, Rachel Levine, transgender,
Berner, can
dual
you
citizenship
speak,
with
please?
Israel,
Yes.
Jew.
I'm going to ask that you hold off, Christopher.
Ma'am, I'm almost done.
Mr.
Head of
Mr.
Pfizer.
Wood, the chair has ruled that your comments are out of order. She's asked you to stop.
How is it out of order?
The chair
How is it
has.
out of order? He said Jew. There's nothing wrong with Jew. It's not derogatory. Yeah,
Exactly.
If you say Catholic or Protestant.
Okay,
how is
keep
that
on
out
going.
of order?
Head of Pfizer vaccines,
Again, the
Albert
chair has-
Bourla, dual citizenship with Israel, Jew. Pfizer chief scientist, Michael
We
Dostin,
need
dual citizenship
decorum
with
here.
Israel, Jew. Moderna chief scientist, Tal Zaks, dual citizenship with Israel,
Christopher,
Jew. BlackRock,
please.
everyone know BlackRock? BlackRock CEO, Larry Fink, dual
Please,
citizenship with Israel, Jew.
Christopher.
I said we're willing to sacrifice our ego, our reputation,
You have
and
19
our lives.
seconds.
Yes, ma'am, and I love you, and I appreciate your patience. BlackRock president, Rob Capital, dual citizenship with Israel, Jew. The CDC chief medical officer of Johnson & Johnson, Joanne Waldstreicher, dual citizenship with Israel, Jew. Chief medical officer
You are
of
done.
Merck, Michael Rosenwald, dual citizenship with Israel, Jew. Head advisor of the World Economic Forum, Yuval Harari, dual citizenship with Israel, Jew. And that's only talking about COVID. That's not talking about who's in charge of our
Christopher, you
government.
need to
That's not
stop.
talking about who's in control of the media or the banks. I can go on. God bless y'all. Thank you for your patience.
I came a little bit late, I got tired, but someone here wishes to yield or see their time, so you don't want to be yet with what else to say. I would love to take your time as a board. If someone sees their time, I'd like to speak. If they don't want to be redundant, that's a different profile, look at it.
I'm sorry, but we cannot do that due to the 5-minute ruling in the public comment. We needed to know 5 minutes prior to the start of the meeting. All right, next one is James Yedis.
I would like to thank Jennifer for bringing this resolution forward. And I don't know if you guys listen to Dan Bongino, but there's something that was relevant to this meeting. I'll play it for you here real quick. It's about a minute long.
Times talked about Cochrane. Put that on the screen. The most rigorous and comprehensive analysis of scientific studies conducted on the efficacy of masks for reducing the spread of respiratory illness, including COVID-19, was published last month. Its conclusions, said Tom Jefferson, the Oxford epidemiologist who is the lead author, were unambiguous. There is just no evidence that masks, make any difference. He told the journalist Mayan Demasi, full stop. But wait, hold on. What about the N95 masks as opposed to the lower quality surgical or cloth masks? Makes no difference. None of it, he said. Well, what about the studies that initially persuaded policymakers to impose mask mandates? They were convinced by non-randomized studies, flawed observational studies. How do we get beyond that finding of that particular review?
So, Christine, that was for you. There is a lot out there this is all political. This is all political, okay? This is a great step by Marathon County, this health department, this board, to take a stand against what I consider corruption by our government and to keep our individual freedoms according to our Constitution in place. And I hope that everything goes well here, it gets voted for, and gets put towards the county board, and they put this in place. Because we, in this county, right here, right now, can take a stand and say to the rest of the country, we can do it, so can you. Thank you.
Thank you, James. All right, that concludes our public comments. We're going to move on to item 4, approval of the August 2nd, 2023 Health and Human Services Committee meeting minutes.
I'll make a motion to approve the minutes.
Is there a second?
I will second.
Okay, Cavelli made the motion and Krause second. All those in favor?
Aye.
Aye. Opposed? Okay, motion carries. We're going to move on to policy issues, discussion, and potential committee determination. 5A, Health Department licensing fee restructure.
All right, thank you, everyone. My name is Kate Florick. I am the Environmental Health and Safety Director for the Marathon County Public Health Department, and I am here to tell you a little bit about our environmental health licensing and water fee restructure proposal. So to the committee members here, thank you so much for taking the time to read through the proposal that I put in your packet. It is lengthy, it is complex. I will do my best during the time that I have to explain it as simply as I possibly can to hopefully have it make sense. Next slide, please. So first, let's just start off a little bit about what is environmental health and what is a sanitarian and what do they do. So according to the American Public Health Association, environmental health is the branch of public health that focuses on the relationships between people and their environments, promotes human health and well-being, and fosters healthy and safe communities. Environmental health is a key part of any comprehensive public health system. The field works to advance policies and programs to reduce chemical and other environmental exposures in air, water, soil, and food to protect people and provide communities with healthier environments. So that's a mouthful. How do we operationalize that? How do we make sense of that definition? If you could go to the next slide. So if I just want you to think a little bit about the places that you go. So have you ever been to a restaurant? Have you ever, you just got to keep clicking. Have you ever gone to the fair or a pool or a hotel to stay or a campground or gotten a piercing or a tattoo or lived in a manufactured home community or drank water or possibly had any sort of interaction with a human health hazard like pests, mold, radon, lead, anything like that. If you said yes to any of those questions, then you have interacted with environmental health and public health. So we are the front line. We are here to ensure your health and safety at all the places that you eat, drink, play, visit, and live. Our sanitarians are an educated workforce. They all have bachelor's degrees, some have master's degrees. They all have to go through a certification process in order to conduct inspections across all of the different licensing types that we have. So we are right there at the front lines in public health. So more specifically, what I'm here to discuss or to answer questions about is what are the problems that we're solving with this fee restructure and why are we doing it now? So we have had at least 20 years of the same fee structure at the Marathon County Health Department. I have been in my position for 6 months, so I have not had the joy of being here for all 20 of those years. But even my predecessor, who has been in the role for quite some time, these fees were set prior to his tenure. The methodology at the state is changing. How the state looks at complexity of the various license types that we do provide, it has changed over time. The amount of fees that we pay back to the state, we act as an agent of the state through 2 different agencies, two different departments, in order to license the various places that we do license. Costs continue to increase. We have staff that have remained in their positions, some for 25 years. And, we obviously have to compensate our staff appropriately. And there is a strong desire for this area of public health to remain off the levy if possible, when possible, to the extent that we can, because we do have the mechanism of having licensing fees. And then finally, just the desire to create a better fee system, one that makes more sense. I'll talk a little bit later about how we tried to simplify it, make it more consistent, and make it more fair across the board. So purpose and goals. Our purpose really was, as I said, to review the current fees related to licensing to determine if our expenses are adequately covered, as well as to compare those fees to the state, not only their philosophy, but also what fees they have set, as well as other counties, both in our area and throughout the state of Wisconsin. Our goals, I think, are pretty straightforward. We want to make sure that our costs of operating the licensing program at the Marathon County Health Department are covered. We want to make sure that we're delivering high quality and consistent services across the board, not only to our end users, which is the public, but also to our operators, so the middle user, that truly are the ones ensuring that safety. We want to make sure that the health and well-being of residents of and visitors to Marathon County is ensured, and we want our fees to be better aligned with state regulation and philosophy. So as I noted moments ago, we looked at 3 guiding principles. First, simplicity. By definition, by nature of the types of places that we license, simplicity is hard to achieve, but we did our best to simplify the fee structure where we could. Second, we wanted to be as consistent as we possibly could, so across the board, applying the same principles fairly. And then finally, fairness. We weren't necessarily always using that as our first guidance, and we wanted to make sure that what was fair for one organization was fair for the next. Transparency is huge. Obviously, we want to make sure that people understand what it is that we're doing. So you're fine. You can go to the next slide. So what we looked at with that was total gross revenue or size of the organization, with the theory that or the assumption that if you're serving more people, you have the potential to have more impact on public health, as well as the very practical application of a larger facility takes longer for our sanitarians to inspect. The other piece we looked at was the complexity rating. And this is really something that the state is moving towards across a variety of settings, whether we're talking food or campgrounds or pools, really taking a look at how complex of an operation do they have, and then having higher fees related to that complexity. Again, because the risk of foodborne or waterborne illness is higher when you're doing more complex things. Therefore, your negative impact on health and safety is higher, and you have the potential for more hazardous business conditions. So looking at our overall budget, you can see that even though I show the actual in here of 2022, our fees have not increased since 2021. So we've had no increase to the fees that our operators pay since 2021. These would go into effect next year, July of 2024, if they are passed. So we have about an $82,000 increase in total to the Marathon County should these fees go into effect. You'll see at the bottom that's about a 2% margin over what our expenses are. That's about an $11,000 gain. I like to think of it more as a buffer. Projections are just that, because we are including complexity ratings into our formula where we were not before. Some of the assumptions that we made are just that. We did our best to go through and look at all of our different facilities and place them in the categories that we thought they were most likely to go into, and go from there. So I have a few examples to hopefully make it a little bit more simple, a little bit more straightforward. So our first example comes from our retail food serving meals, which is a fancy way of saying our restaurants. So our restaurants currently are not stratified at all by their risk rating. They are only stratified by their revenue. So a small restaurant that has a gross revenue of $25,001 up to $250,000, regardless of what their complexity rating, pays $685 a year for their license. A medium restaurant with a gross revenue of $250,000, also we're not doing a complexity rating on them, would also pay $685. Under our new proposed fee restructure, a small restaurant with that smaller gross revenue of just over $25,000 with a simple rating. So they don't have a buffet, they don't have a takeout window, they're not doing any catering services, they're not cooling and reheating food. It's a very simple operation. Their fee would be $623.16. So they would actually see a decrease in our new fee structure. That medium-sized restaurant with that gross revenue of $250,000, however, would see an increase in their license fee to $739.82 because they are rated as complex. So they have that bigger revenue and they have a higher complexity. So our hypothetical restaurant might have that buffet. They might have that catering service that they also offer. They may be hot holding, cold holding, things like that increase that risk. Yes.
Sorry, could you go back to the last slide, please? A question on the fee, the current fee, $685. I noticed on the proposed fee you have plus state fee. Does that $685 on the current fee include the state fee or not?
Currently, we do have the state fee rolled into that singular fee. What we're proposing is that we separate that out as state fees do change, and then it's very transparent if it's a Marathon County portion of the fee that's increasing or if it's the state fee that's increasing.
Okay, thank you.
Yep, absolutely. Next example comes from retail food not serving meals, which most simply is grocery stores, convenience stores that aren't doing any food prep, which are becoming fewer and far in between, but there are still some, or places like ice cream trucks where they're just serving pre-packaged food. So in our current structure, we don't look at revenue for some of the types within this large category, which is, again, going back to that consistency piece, is wildly inconsistent because it's the only area where we're not applying one of those factors, whether it's revenue or size. So a large grocery store chain would pay $68 for their license, and an ice cream truck that maybe only operates 4 or 5 months of the year would also only pay $68 for their annual license fee. Under our new proposal, where we apply those concepts of consistency, fairness, and simplicity, we would look at their revenue as well as their complexity, and that large grocery store chain would be hypothetically paying around $500 for their license, and that ice cream truck would be paying about $100. Another example from Body Art. So right now, our fees do not align with the state structure. We have in place, if it's a temporary event, that they pay a lower fee amount than if it's a brick and mortar facility. It really doesn't represent the effort needed to inspect either a standalone facility or an event. So rather than having two separate fees set for those categories, we're aligning those fees to be the same as well, and which is what the state also does. Manufactured home communities, we had a fairly complex way that we were calculating the fees for this particular license type, where we had a range of numbers of sites, and then we had a multiplier of $1.33 for each one of the sites at that manufactured home community. We're proposing that we eliminate that per site multiplier. We just have the range that has a base fee, and that's it. Keep it as simple as possible, but again, separate out the fees from what we charge as a county to actually go in and do the inspections to what we are paying the state, both in terms of some water fees that we pay, as well as just the fees that they charge us as the agent. In addition to the licensing fees or licensing inspections that we do, we also work with our operators. If it's a new operator or a change of owner, we have to conduct pre-inspections. If we have operators that either have a total number of violations that triggers a reinspection or a certain type of violations that triggers a reinspection, we do go in and conduct reinspections on our facilities from time to time. Right now, we do not have an operating without a license fee. We are proposing that should we find somebody who is operating in one of the many categories that we license without a license, that we have some recourse at our discretion to use. So that would be a brand new fee. And then our late renewal, or our late fee for our renewals, we're proposing we would increase as well. It's been $50 for quite some time. And I can say, having lived through 1 year now of the renewal process, there is a lot of effort that goes into ensuring that our operators are paying on time. We start in about May for our June 30th deadline, and there's lots of phone calls, emails, mail that goes through the United States Postal Service. It's quite an effort. And still we have about 100 people or 100 operators that don't pay on time. So the next set of slides I'm not really going to go through. It just goes through each and every one of our license categories. So first is our retail food serving meals. Next is our retail food not serving meals. So again, more of our grocery stores. Then we've got our micro markets, which are those little canteen kind of places you see at like Aspirus. There's one at North Central Healthcare. There's quite a few in the county. Transient retail food establishments, those are similar to your mobile units, but they don't operate as frequently as a full mobile unit. We license all lodging and pools, whether that's hotels or tourist rooming houses or bed and breakfasts, as well as all of our pools that are at hotels and our seasonal pools like Kaiser. Campgrounds, we have recreational educational campgrounds. Of note here, the state has moved, as well as with pools, I didn't mention on the last slide, but they have moved to update the code, which goes into effect in this month, at the end of this month, to reflect that complexity rating. So rather than just having, do you have one pool, do you have two pools, they look at a simple, moderate, and complex rating system. Body art and manufactured homes, there are only two facilities types that we license through DSPS. Otherwise, we go through DATCAP. Again, just the 2021 fees and then the 2024 proposed fees. I'm going to pause there for just a second and ask if folks have questions or any further questions about the licensing for fees for our facilities, for our operators. Go ahead.
Thank you.
Yeah.
So you mentioned that you would hope not to use tax levy for any of this, any of these programs. Are you anticipating that the fee increases will cover all of your costs and expenses?
Yes, that is correct.
Okay.
For the licensing program.
And if you did have to use tax levy, how would that work? Maybe Lance can answer that.
Well, that's a good question. I guess I'll start with the building on what Kate laid out with the philosophy and kind of what led us to be here is the direction from the county board to, through the budget process, have everyone look at their fees, their fee philosophy. And my understanding of our longstanding guidance with the health department from the Board of Health is that this area of our work should be supported entirely off the tax levy, to your underlying point. Now, to Kate's point earlier, we're relying on some assumptions to do that. We'll monitor that and report back. I'm reasonably confident. I mean, we do have funds necessary to support this work. If we find out we need to change fees again, we'll be transparent with you in doing that. We can just tell you right now. I met with Kate and Laura before they presented to the Board of Health. I supported this move to kind of that three-prong approach. I mean, I think it better accomplishes the goals that the county board has set out for particularly this program. My understanding, the Board of Health conversation asked, we sought feedback. Are we heading in the right direction? Are we heading in the wrong direction? The general consensus was, hey, this is the right direction. My goal is to include this new fee structure along with all the other fees that you previously seen as an appendice in the budget. So to be very transparent of what is driving our revenues for our particular programs within the budget. So if my specific answer to you of what's happening if we find out our fees aren't enough, we'll come back and we'll report that to you.
Thank you.
Are there any other questions from the board? Okay, Kate.
Okay. But wait, there's more. I'm going to talk to you a little bit now about our water lab that we have at the health department and the fee restructure that we're proposing there. And really, there's a lot of overlap, so there are some pieces of the slides that I'll probably just skim over unless there's specific questions. The biggest difference is that the philosophy for the water lab does differ in that there is some expectation that we keep our costs low and therefore do rely on the tax levy to an extent, not a great extent, but to an extent so that we can continue to offer lower on average than our competitors' fees. So our water lab is there to test private and public drinking water as well as recreational water. So recreational water being our pools and our hot tubs in the community, in the county, excuse me. We not only provide high quality water testing, but we also educate our customers on how to sample their private wells, how to interpret their test results, all in the name of ensuring that safe drinking water is available. Environmental health lab technicians typically have a microbiology or a chemistry degree, and they often come to us with many years of working in the field in a variety of settings, not always just in water labs. So again, our purpose and our goals for reviewing this is to just say, what are we covering, how much are we covering, and then compare our rates not only to some of the private labs here in our community, but as well as with Wisconsin State Hygienic Lab. Similar to the goals from before, we're really just trying to make sure that we cover our costs, that we're providing a high quality and consistent service, and that the health and well-being of residents of Marathon County are protected. So fee setting philosophy, we have not increased our fees since even earlier than the licensing fees. So 2020 was the last time that we came to the board for approval to increase these fees. Like I already said, we do rely to an extent on levy funding to keep our costs low, especially for municipality water testing, as well as just to be competitive with larger labs and so that we can offer this service to Marathon County residents at an affordable rate. Again, we're applying that simplicity, consistency, and fairness concept across all of our fees. As many of you are aware, costs are increasing. In the lab in particular, we've seen some of our supplies increase as much as 50% over the last couple of years, so there's been some pretty significant increases. Our staff in that area also, through the wage study that was done, did see an increase since 2020 that needs to be accounted for. And then again, we're just applying those principles of simplicity and consistency and fairness. So these fees are much more straightforward and it fits on one page, so there's not multiple pages to have to go through. But just to highlight a couple of things, we have a program with the DNR where we test wells for businesses that serve 25 or more people 60 or more days of the year. Think your taverns out in the country that are on well water or churches, to make sure that they have safe water to provide. And we were charging less for that program than we were for private citizens, so we're aligning those two fees. Our heterotrophic plate count and suit alert fees for our pools and our hot tubs were reduced by half during the pandemic. We're proposing that we return those to the full rate, and then modest increases on the heterotrophic plate count test and a little bit more of an aggressive increase on the suit alert test. We're well behind the rest of the community in terms of those fees, but just increases just to keep us a little bit more in line with what other labs are charging. And then our municipalities, we do perform a lot of coliform and nitrate tests for them, and historically, well, right now, without the proposed increases, it's a very steep decrease for them. So we are proposing to increase that a little bit, but it's still far below the cost if they would choose to go to a different lab. Other areas, when you see the next slide with the budget, we do a lot of water testing for the United States Forest Service for the various land that they have where their water is available. Lead and arsenic tests are subcontracted to the Wisconsin State Lab of Hygiene. What we do is we just charge a processing fee so that people can drop off that water at our lab if they're also processing other water samples, and then we just go ahead and get that to the state lab for them. It is important to note that we are currently reviewing certain tests. We try to remain as current with like pool code and things like that, so that we're matching the science appropriately. And if we make some changes, there could be some impacts to the budget, which of course we would come to the board next year and say, our anticipated budget is going to be less revenue because we are no longer requiring either a certain test or a certain frequency of tests. So that is currently under review. So you can see here, these are all of the tests that we perform at our lab, minus the lead and arsenic. Those both go to the state hygienic lab. And you can see our fees that were from 2020 and then our fees for 2024, along with our projected revenue, about a $43,000 increase with the projections, but still representing about a $60,000 loss to our operations. Any questions? You can.
If I may, Madam Chair. Just to add a little bit more context, and I know there are other members of the county board that are in the room that can elaborate, but my understanding as to one of the rationales for why, unlike our sanitarian approach, which is where we want to cover all of our costs, where the approach has been that a slight public subsidy, for lack of a better term, is appropriate, is that our municipalities benefit substantially from very prompt water tests. We can perform those tests, generally speaking, more promptly than sending it off to a private lab, which again contributes to the public well-being, so that if we have a municipality or a local provider where individuals are in those environments, we can get them the information they need to kind of return that water to a safe state much more promptly. Is that fair to say, Kate?
Yeah. I mean, even just the shipping time to get it down to the hygienic lab, we can start running those tests same day. And when they bring them in, we do, because some of them have a shelf life, for lack of a better word. You got to run that water test right away.
Supervisor Sandelsky.
Thank you. I just had a question on the actual 2022, as far as, okay, there's the revenue for 22, but is there expenses from 2022? Do we have any history of that on that one?
Yeah, so that would be the 187, 149.34. So that's your lab supplies, staff, equipment, et cetera. So in 2022, we saw more of an $80,000 loss. And with this fee restructure, we would be looking at more of a $60,000 loss. So a little less reliance on the levy.
Oh, I was looking at page 6, actually.
Oh,
Sorry.
not the water one.
Yeah, on the total budget for the total numbers. Because
So that's just the licensing budget.
Oh, okay.
That doesn't include, I don't know where. That's the whole thing. Yeah, I only have in the proposed, I could certainly get you the actuals for 2022.
Okay, thank you.
Yep.
Are there any other questions?
Just a quick
Supervisor
question.
Unger.
Thank you. Just a quick question. So I see, some of the fees from 2020 and then you proposed for 2024. There's not a big difference.
There isn't.
And I see there's still a deficit of 60,000. So what was the rationale for not, going a little higher?
Yeah, so we really wanted to make sure that we weren't outpacing our competitors, particularly here. There's a lab in Weston that does water testing, and the next closest one is Marshfield. So knowing that we wanted to be able to provide a public service, we said, how do we keep our fees even just slightly below what our competitors have? And then the other piece is you'll see our municipalities make up a significant amount of our revenue, and those fees we keep intentionally low for the reasons that we've covered.
Great, thank you.
Yeah, absolutely.
Supervisor Cavelli.
Thank you, Madam Chair. So in effect, are you looking in the budget at a tax levy of about $60,000 to support this?
kind of.
So the way that we were approaching this is that this would be part of our department's budget that would be forwarded to the county board through Lance's budget proposal.
Thank you. Any other questions? This is where we would do a vote to push it to, is it Human Services or County Board?
If I can weigh in on that.
Thank you.
Yeah, thank you, Madam Chair. This is, we brought this through, the staff brought this through the Board of Health to see if we're moving in the right direction. We're building the budget right now. I'm supposed to have here, my goal is to have the budget delivered by the end of this month. I'm just really hoping to get feedback. If we're heading in the complete wrong direction, let me know. If you support us incorporating this into the proposed budget, the county board can always make changes to the proposed budget at a later date. But I know our timetable is pretty compressed. So and I don't know, Corporation Counsel Purner, if it would be appropriate, but if you were in support of this approach, having us update these fees, a motion to support the inclusion of the proposed fee schedule in the administrator's proposed budget, I think would accomplish what, at least the guidance that I'm looking for.
Is there a motion?
I'll make a motion to present this to the full board because I think it's heading in the right direction. I'm not sure if it's the answer to a lot of questions about tax levy, but I think it's moving in the right direction. Looking at instead of a $70,000 deficit, a $60,000 deficit, at least it appears to be heading in the right direction.
Is there a second?
I'll second.
Second by Donna Krause. Are there any questions?
I have a question, Madam Chair, and this is for Supervisor Cabelli. Just to clarify, your motion is to move this to the full board, or is it to have the administrator incorporate this in his budget, which would then be presented to the full board?
I would say incorporate it in the budget. I think that would make sense.
Okay.
And then the full board can decide after that.
So then we don't follow through with the motion.
No, you can vote on the motion, and if it passes, then the administrator would take that direction back to his budget building process, and then the board would ultimately review that at budget time.
Okay, thank you. Any other questions? Those in favor say aye. Aye.
Aye.
Opposed? Okay, it stands. All right. I would like to do a little switch up in the agenda here. I would like to move Krista Jensen's presentation before we discuss the resolution in opposition to COVID-19 mandates. So we're going to move to 7A, Children's Long-Term Support, CLTS, presentation by Krista Jensen. And the reason I asked Krista to come here is because this was something that the board, the full board had voted for, and she had sent out some slides to the county board supervisors, and the slides were not, the presentation was not presented at the county board, and I felt that it would would show transparency, even though the decision was made. But if we would have Krista just let us know and go through the slides with us.
Absolutely. Thanks for having me, and thank you for your support and approval of our position request at the last county board meeting. We're going to get the PowerPoint here up for you all, so I'll just wait a moment. I think I'll just get started while they're getting it going. The first slide is really an overview of what the CLTS program is, which I understand has already been provided, but in the time that I was preparing, this PowerPoint was for County Board in response to Supervisor Baker's initial resolution. And so in that PowerPoint, just provided an overview, which I'll share. We have quite a number of individuals here. So the CLTS, or Children's Long-Term Support Program, provides wraparound services to children with disabilities and their families who have substantial limitations to their daily activities and need support and services to remain safely in their home and here in our community. The Wisconsin Department of Health Services, or DHS, does use Medicaid funds to offer these range of services to county waiver agencies, which Marathon County Social Services is one of those county waiver agencies, or CWAs, to ensure that families can access these services. The CLTS program is fully funded by federal and state government, and it is voluntary for families to participate in. There were some questions in regards to the funding, so I had provided the state and county contract with the Department of Health Services that we do have, and reference at Appendix 40AM, Section 2, specifically explains what that funding is if you're looking to see that in more detail from the federal and state government contracts. So a child's eligibility is based on their functional limitations, which can include physical, developmental, or emotional limitations that restrict their ability to carry out their daily living activities. We support the children and family depending on what their needs and goals are, and the program can help to pay for supplies, services, and supports above and beyond what private health insurance or Medicaid covers. So, for instance, if a child is in a setting where Medicaid is covering that, then Children's Long-Term Support no longer provides for that because you can't double bill Medicaid. That was a question that had come up in the past of if children are placed in out-of-home care, if CLTS services are still eligible, not if they're in a hospital setting or a high residential level setting that Medicaid is paying for. So some examples of services and supports that CLTS program can fund include things like home modification, so a fence or a wheelchair ramp, something of that nature to provide for safety. Caregiver services such as respite or supportive home care for their children who have significant limitations, and then adaptive aids such as service animals or adaptive bicycles and things of that nature. So you can move on to the next slide, which specifically references each of the questions or information that Supervisor Baker had requested in his resolution. And so I've listed those out for you here, which were the total number of 2023 referrals to date and the total number of assessed to date, the referral source for all of the 2023 referrals that had come in by date, and then he had referenced a few specific individuals he was interested in. He had asked for a chart in regards to the referrals, a chart in regards to the length of time that they've lived in Marathon County. However, we are unable to provide that information. There is information in the contract, which you've all been provided from DHS, that references the need to continue providing services even when children move out of your specific county. You must refer them to another CWA, and until that other CWA is able to pick up those services, Marathon County is required to continue providing them, just as would, say, for instance, Brown County. If they had a child move here, they would need to provide those services until we had the capacity to pick up that family. Excuse me. He also had asked for a graph of total referrals from 2018 until 2022, and an assessment of the impact of the January 1st, 2022 program changes he had referenced, and enhancements on the number of 23 referrals. So the next slides will specifically answer all of those questions that he had referenced. The first slide is the number of referrals to date and the number assessed to date. Now, I will say that this data is as of August 21st of this year, so it is not as of today. So as of 2020, that date in 2023, we had assessed 53 and had 64 sitting on our wait list as of that time. So those 53 meant that those initial functional screens were completed to determine if they were eligible for the program or not. The next slide talks about the referral source for all of the referrals that we've received in 2023. It gets a little jumbled because there's quite a few, but we tried to separate it out as much as we could. I will reference that, excuse me, the social worker is not specific to what kind of social worker. So that could be a school social worker, a hospital social worker, a DSS social worker, or a social worker really of any capacity. So that's not specific to any type of social worker particularly. But you can see that there's a variety of different providers who make referrals, being birth to 3, hospital social workers is specifically in there, so excuse my statement about that one in particular, school counselors, medical providers, just other community agencies, and then parents. Parents often have a support network of other parents who have children with similar levels of functioning and need, because that provides them the support that they need, and so they often will hear about the services that we offer, and then they hear about them that way and make themselves available for those services if they desire them. The next slide will talk about the referrals by the child's age, and so you will notice on here, if you were to add up all of these numbers, it is more than 117, and the reason for that is on average there's a 5-month wait list for these services prior to these positions being approved, which was one of the reasons that this board moved to do that. And so these referrals on here, there's more than 117 because some of those children have been sitting on the wait list from 2022 until 23, and so they're still referenced here if they were waiting. And so you can see that there's a wide range from 0 to 18 of referrals that we receive. Quite a big jump in our 3-year-olds, which I would probably equate to birth to 3 services, and those services ending, and those families needing to continue to receive services so that those children can stay here in our communities. The next slide will talk you through the total referrals by year from 2018 until 2022 as requested. You can see that we've remained pretty steady. 2022 is definitely a higher year for us, but not that much out of line with 2018 and where we're at as of 2023 with that 117 number. And again, it's referenced on the bottom that that's as of August 21st of this year. The next slide will talk through the questions that Supervisor Baker indicated regarding the changes to any sort of programming. So on July 21st of 2020, there was an algorithm change to the CLTS functional screen to align with what is state law. So they were not previously aligned. That has most likely been a contributing factor to increase, as the previous algorithm was more restrictive than what was stated in the law. So they just got things kind of on the up and up about this was what the law said, and making sure that the algorithm change matched that. In January of 21, the Department of Health Services implemented a state-level budget and enrollment and administration to our program, which essentially meant that if children were assessed for services, they needed to be moved right into receiving those services. Prior to that, we would have children who sat on the wait list, they were assessed, yes, you're eligible, and then they sat on another wait list waiting for those services to actually be provided. In 2021, that's what went away, is that ability to put them on yet another wait list to wait for those services, even if they were eligible. Through the state budget, DHS awarded funds to eliminate the wait list, and so we received those funds, which was another reason that this board moved to approve those positions. And they will continue to monitor our compliance with achieving that continuous enrollment for the CLTS program. It is important to know that as of June 22, Marathon County had eliminated our wait list, so we were in compliance at that point. However, due to the increase in referrals, a wait list was restarted here in Marathon County beginning January 6th of 23, and you saw where those wait list numbers are. In a previous presentation, you saw the number of referrals that we had been receiving on a monthly basis for 23, and that's why we currently have a wait list. The requirements to be eligible for CLTS do not change, so such as like the disabilities that you must have, those have not specifically changed. So they haven't gone from a lesser restrictive to a more restrictive or vice versa. All children who are found eligible must have a diagnosis of some sort, whether that's medical, developmental, or psychiatric. The waiver programming is updated every 5 years by DHS. Now that, again, is not in regards to which children are eligible, but it is in regards to what services may or may not be authorized through the Medicaid program. So when a county enters into the contract with DHS to be a county waiver agency, we must abide by that contract. That includes timely access to standards, which we just spoke about, and those updates. And they're also located on page 13 of the manual, which you were provided and has a link here. So you can go ahead and review that if you wish. It does specifically speak to that. We did reach out to DHS on 8/22 in anticipation of our upcoming board meeting to ask if there was wiggle room around those standards, and you can see we just copied and pasted what their response was, basically saying, again, there is no wiggle room around these standards to say we don't have enough staff or our caseloads are too high to take children off of the wait list to provide services. We must do that. And so again, that I believe is a key component as to why this board moved forward those additional positions to ensure that we were able to meet those requirements. And again, this is again referenced in the state and county contract in Appendix Section 3D, and that was also provided to you in your packet for your review. And then, as we were preparing this for the county board, we had just indicated that the impact to approving these requested positions was that there was no cost to be offset due to the funding nature of the program being state and federally funded, so there's no tax levy that goes into these additional programs to support these children and families. It will allow for us to have the timely submission and reimbursement of all of those associated CLTS costs and claims. We would not be placed on a corrective action plan by DHS due to not meeting the requirement, which is listed in the contract. It would positively support families and children with complex needs to decrease the likelihood of them in needing an out-of-home placement. And as you are well aware, out-of-home placements are within tax levy, and so we don't need an increased utilization of tax levy because of increased placements. And it also allows our staff to have manageable caseloads and supervisory support to limit turnover due to burnout and ensure that they can provide comprehensive best practice services to those living in our community to help them to stay here and be supported. You're welcome.
Thank you, Krista. Are there any questions from the board? Donna.
I'd just like to thank Krista for putting this all together and all the extra work it took to do that. Thank you.
You're welcome. Thank you.
Anybody else? Supervisor Baker.
Thank you, Vice Chair Ariston. I'd like to thank you for requesting this presentation. I appreciate that you did that, and to Director Jensen for providing this in response to my request. And I'd like to compliment you. It was very well done and very informative. Thank you for that. And so I had, just as background for those who aren't aware, I had made a potential amendment that requested this information and partially delayed the proving the positions. But Director Jensen was very responsive to that request, so I did not offer that amendment, and it was passed with very high, almost unanimously, not quite. And the purpose for that was that I was concerned why the data we were given, there was a 21% increase in 4 months of children that had disabilities to qualify for this, and I was concerned that we should look at the root causes for that. If we're having a huge increase in disabilities in our county, that we should look at the root causes, and that was a motivation for the data. I would ask if there's a way that we can add the one piece that's missing to a questionnaire, to collect that data, if that would be available, if you could consider that, and let me know if that's something that we could do in terms of the length of time that people have lived in the county. Because the concern is if there's people moving into the county that need services, that's an issue. But if our established population is increasing rapidly in terms of needs and disabilities, I think that's something that, and I understand it's not the social services department that's responsible for that, but maybe the health department or other parts. So that would help distinguish whether that is something that's happening in our county. We're trying to be the healthiest county, and if we're having a high increase in disabilities, that runs contrary to that. So that would help, I think, to help us distinguish that. So but again, you did a very nice job. Thank you very much.
Thank you.
Are there any other questions? Thank you, Krista. All right, I am moving the health officer role from 7B up to be next, and then the resolution in opposition to COVID-19 mandates after Laura Scuderi's presentation. It's page 143.
Okay, I think yep, okay. On page 143 in your packet, the document that we have created for you is Overview of Health Officer Authorities. That document was created by Corporation Counsel Michael Pierner and I late last week at the request of the chair. It gives an overview of health officer authorities. I will walk us through the document, but I do want to preface this overview by saying that a health officer in Marathon County cannot mandate masks or vaccines. We can isolate and quarantine, but there are restrictions and limitations to that authority. Activities regarding communicable disease mitigation are regulated by the state. I also want to highlight that the health officer authorities encompass a number of activities, but are not exclusive to COVID. We also respond to tuberculosis, which we have cases of in our county currently, meningococcal disease and Hep B, other Category 1 communicable diseases, food inspections, and more. You will see here that Corporation Counsel Pierner and I tried to reference the state statutes and administrative codes for your reference throughout this document. So the first question is, what are health officers required to do if they suspect or have a confirmed communicable disease in our county? Health officers are tasked with investigating the circumstances surrounding the disease, and we have to report on that investigation to the state. We also work to mitigate further exposure for the public, and we are tasked with ensuring that our response meets the threshold of reasonable and necessary. The next question is, what are the actions that health officers can take to prevent or control communicable disease spread if the case has been confirmed? Health officers seek voluntary compliance with isolation or quarantine guidelines. For example, in the last 17 years, we have not had to get an order to isolate, as we use public health nurses and public health and other medical providers to provide education, and we use culturally competent care to work with patients to understand their diagnosis. What action can a health officer take if a person with a confirmed diagnosis poses a risk to others and does not voluntarily comply? Thankfully, we have not had to go this route yet, but with serious infectious disease risk like tuberculosis, we would go through this process as outlined on page 3 and 4, and you can read about that in detail on those pages. If the patient refuses to comply, we would petition a court with clear evidence that the patient poses a threat to the health and safety of the public, and we have to prove that we are using the least restrictive methods to protect public health. I would enlist Corporation Counsel Michael Pierner, and we would look at the least restrictive action that could be taken while also ensuring the safety and of the patient as well as the public. A question that has popped up is whether a health officer can issue general orders to the population, say, on masking. And the answer is that Marathon County does not have a communicable disease enforcement ordinance. So while an order can be given, it is only advisory. There is no enforcement of that advice. I should note that private entities like universities or colleges may choose to enact rules separately from the health department. Nursing homes, hospitals, and medical centers follow CMS and state regulations, not local health department authority. For the question about whether Marathon County Health Department can issue a vaccine mandate, we do not have that authority. The state has the authority to address immunization requirements per Wisconsin Administrative Code DHS 144. I do also want to mention that private entities like businesses can create a vaccine or masking mandate if they so choose. This is not under the jurisdiction of the health department, however. So this document can give you a sense of the limitations of health officer authority. Corporation Counsel Pierner and I are happy to answer your questions about this information. Thank you.
Thank you, Laura. Are there any questions? Supervisor Leamer.
It's Limmer.
Thank you.
I just assume you read the resolution that we'll be discussing later. Pretend that was in effect at the time of the health emergency in 2020-2021. What changes or impacts would this resolution have had on the county with what we did?
It's really hard for me to speculate about that as I was not the health officer at the time.
Thank you. Are there any other questions? Supervisor Unger.
Thank you. So I heard that at this point, there's no enforcement for the health department, or the health department supervisor. But what about the future? I mean, can the state come down and say, oh yeah, we give that authority to the health department?
Mike, do you want to?
I mean, what is how do we know that that's not going to happen?
Sure. So, as Laura referenced, one of the ways enforcement can happen is through the county board passing a communicable disease ordinance. So the board could pass an ordinance. Otherwise, I don't know what the change in state law would be that would direct health officers to do that. I think it would continue to be a state enforcement issue, but I hesitate to say that I can anticipate any law changes. There might be something that could happen that I'm not thinking of, but generally it would be a state decision.
So what I'm hearing is it could happen. You don't know
Right.
how,
I
but
don't
it
think you can
could
say
happen in the
either way.
future.
Donna Krause.
Hello, I would think that the state legislature could make certain laws, and if they were passed by the state legislature, that various state departments would have to abide by that law.
I think that's fair to say, yes.
Okay, thank you. Any other questions directed to Laura Scuderi? Supervisor Felly.
Thank you, Madam Chair. And thank you, Laura, for the presentation. Just a question on information and how you gather the information and where you get it from, so we can, kind of garner that same information that you're seeing.
Oh, so information regarding the state laws. In the information that I provided, there are links to all of the different information. So the state statutes and the administrative code that I am referencing should be in your packet in this document.
Yeah, sorry, I should have clarified that a little bit. As far as nationally, and national issues and health issues that are going on, where do you get the information from?
We get our information from the Centers for Disease Control. We also look to the Department of Health Services in Wisconsin. We are a part of epidemiological groups, and we do coordinate with other health departments within our state.
Thank you. Do you ever get your information from the NIH?
Yes, we do.
Okay. One concern that I have with the NIH is that they received several $1 million from pharmaceutical companies to do their research. I think that's a conflict of interest when they're putting out public information. I think that, that amount of money can sway a decision, not saying that that's what they're doing, but in perception, kind of like, when I get mail from the Hmong Society with tickets to go to the Hmong Festival. I can't use those because it's a conflict of interest. Similar to information that we receive from the NIH when they're receiving this money from pharmaceutical companies. So I have a concern with the information that we receive as a county from the NIH. So that's my comment. Thank you.
Any other comments? Oh, Supervisor Sandelsky.
So yeah, I'm going to piggyback off of what Ron had to say with the NIH and that. One of the articles I actually handed out here recently, I handed out to all the people on the committee here. It says right on the article here, the mass study published by NIH suggests that N95 masks, COVID masks, may expose wearers to dangerous levels of toxic compound linked to seizures and cancer. So, I mean, that's right from the NIH. So if you're getting your information from there, that's kind of a good indication that it's not the mask can actually be very toxic to people and cause a lot of issues. Also, the CDC right here, the CDC top epidemiologist suggests agencies misrepresented scientific data to support the mask narrative. So there's a lot of misinformation that the CDC is actually claiming that they they misrepresented it. It's wrong. Thank you.
Any other questions for Laura Scuderi? Supervisor Baker.
Thank you, Vice Chair Erstead. So I would like to just kind of look at the relationship between the health officer, yourself, and politicians, which unfortunately, I guess I'm in that category. I would not like to be. So a couple of questions. I presume you do not have a law degree?
No, I do not have a law degree.
I do not either, so we're on equal footing. Do you have a medical license of any sort?
I have a master's of public health from Ohio State University, and I'm actually obtaining my nursing degree currently.
I saw that in your background. I'm glad to hear that. I also do not have a medical degree so as well. You do have 7 public health nurses that work for you? Something like that? And they all have medical degrees, I would presume. Okay. So one of the statutes that we're looking at, probably the primary one, is 252. Is that correct?
Yeah.
And you're familiar with the case Wisconsin Legislature versus Palm?
Yes.
And I would presume Corporation Counsel is as well? In that, one of the, I don't know if I have their term right, but justices' concerns was the limitation on the power of the Department of Health in terms of Section 252. A concern relates to what is a communicable disease in the statute. I don't believe that it's defined, really. Is that accurate?
There are communicable diseases that are defined for a Category 1, Category 2, Category 3. So a Category 1 would be like tuberculosis, and then Category 2 would be like Lyme disease. I believe Category 3 would be like HIV.
So so COVID is considered communicable disease?
COVID is, currently, it is listed as Category 1 communicable disease.
And flu?
Flu, I would have to check.
In colds? Are colds communicable diseases?
They are communicable diseases by definition. I'm not sure it listed as a definition within this state statute.
So do you consider, who do you consider that you work for? I guess that's the question. Who do you consider that you work for? The state, the county, the people?
I work for the residents of Marathon County.
Okay. But you have a reporting relationship to Wisconsin DHS as well, or not?
Yes, we do.
Okay. So the relationship between or the characterization of the state is a reasonable area of discussion for consideration of your role. Would that be accurate?
I'm sorry, can you repeat the question?
Is the state of Wisconsin Department of DHS, the state health officer, some discussion is that relates to your role as our health officer, correct? It's not outside the bounds of this discussion. I guess that's a question for Corp Counsel.
I think your question is,
can I ask questions about the case? Is that legitimate questions?
as they relate to the role of the local health officer, I think
Yes.
yes.
Yes. So I can read it I would like to read it, but I probably won't take the time. But there's a long discussion between one of the justices and the Palm's attorney relating to the limits of the powers of Palm. And essentially, the answer to that question was that there were no limits other than what would be pushback from the medical community. Are you familiar with that discussion? I can read that if you'd like.
Yeah, I would prefer you to read it.
Okay.
That would be great.
Let me see if I can find it here. Court, counsel, I have thought a lot about it, and my concern goes back to what the limits are on the secretary, because under your interpretation of the statutes, she can do whatever she wants, and she can order people to jail if they don't comply. And I don't think the legislature can give that kind of power to an unelected individual. State's counsel Your Honor, what I can say is for over a century, courts have recognized that in the context of infectious diseases, it is practically impossible for the legislature to be able to predict exactly what is necessary. You have to keep in mind that this is a novel. It is literally called the novel coronavirus. We have never seen it before. We don't know exactly what it can do. And so the legislature realized that it needed to give an agency with the ability to respond with expertise and a clarity to changing dynamic circumstances on the ground. Court. The logical consequences of your argument, counsel, is that the government could step in and do this. The DHS secretary could step in and do this every single flu season, every year, because the flu kills tens of thousands of people in America every year, and that's a communicable disease. So would you agree with me then that the DHS secretary, under your interpretation, could be empowered to do this every single flu season? State's counsel, no, Your Honor. I think that the DHS secretary, if it tried to do that every single flu season, would have no support in the medical community for imposing that kind of restriction. So essentially, the argument was by the state's attorney that there were no limitations other than pressure from medical community, and I would argue perhaps, you know, political force could also provide guidance to that or provide feedback. Supervisor Sondelsky had asked you if you look at federal government's agencies also as part of your input, which you answered in the affirmative. FDA would be one that we'd look at as well. So there's currently a case between the FDA and 3 attorneys who basically sued the FDA for instructing them that they could not use ivermectin. And I don't have the source for this, so if I'm looking at a news article, but it basically said the courts cannot hold agencies accountable when they provide false or misleading information. The FDA is politically accountable, just like all other executive agencies. So all of this is basically a long way of asking, do you believe that there's a role for the political body, for the Board of Supervisors to provide guidance to the health officer in terms of Article 2, or Section 252? Thank you.
Madam Chair, can I offer one thing? I'm sorry to interrupt, but you asked a question, Supervisor Baker, and please, we certainly go to your question about reporting relationship, and I just want to clarify one piece there. I don't know if people are speaking the using terminology consistently. The reporting relationship our health officer and the health department has, which DHS, is one of reporting information. In terms of reporting relationship, in terms of who is her boss, that answer is very clear. That individual is me. And I work for the board. So in terms of the, I think the question you're asking, is there a way for the political body, the County Board of Supervisors, to provide policy, guidance, and direction to the to staff? Absolutely, you do that through me. And if any one of the employees that then I have doesn't take action appropriate, you have vested in me, through Wisconsin statute, the power and authority to supervise all county staff. Laura is one of those county staff. And that is my duty then to supervise that staff person. The health officer is no different. If you believe that I'm doing that inappropriately, you have absolute authority under the state statutes to remove me from my position and appoint an individual who you believe would do a better job of doing that. And ultimately, as the Board of Supervisors by Wisconsin statute and your local administrative, or excuse me, your local ordinances, you have the role and responsibility of confirmation of the health officer. So I just wanted to clarify the term. I'm not sure what, and I'm making an assumption, I was assuming you were referring to a reporting relationship in terms of the kind of the boss context as opposed to the information context. So sorry to interrupt the question relative to 252.
Supervisor Baker.
So I wasn't asking if there was a way for us to do it. I was asking if our health officer felt that it was appropriate for us to provide guidance like this resolution, or if that it was an issue where we should stay out of it, and and it's her role, and we don't have input into it. So it wasn't so much, I know we have the authority to do it, but I wanted to get her feedback on the, whether she thought that was advisable or not. But also, in terms of, in my recollection, I wasn't at the board at the time, but I did pay a lot of attention. In my recollection, there is definitely a relationship between the county public health officer and the state DHS. I know she doesn't work for them. She works for you, and you work for us. But it appeared that there was guidance coming from the state to the county, that was being followed. So, thank you.
Thank you. Are there any other questions?
I asked a question I'd like a response to.
You wanted my response about the county board's resolution as being brought forward and whether or not, it's my understanding that the county board has the authority to take policy positions, and so to the public and other representatives of the government.
Thank you.
Supervisor Robinson.
Question relative to the authority, in so much as counties are creatures of the state, and our authority is derived through the state statutes and delegated authority, and the fact that there are different classifications of health departments in levels of service. If we are in a situation where we have a policy directive that says we will not enforce COVID regulations, would the state step in, and would that have a material impact on the residents of the county?
I can answer just from a legal perspective, because the counties are creations and creatures of the state. If we're not following state law requirements, the state would, I would say, almost definitely step in. I don't know what the impact would be. It would depend on what enforcement action they would take, but I would assume it would have at least some budgetary impact, but I would just be speculating.
Supervisor Baker.
Could you address the non-hypothetical situation where the state takes action that is then reversed by the Wisconsin Supreme Court and found to be statutorily not in a line? So, I mean, in the interim, we can make decisions and maybe reverse in the future, but, I mean, there was a year where our governor was not following state statutes as determined by the Wisconsin Supreme Court.
Kind of a broad question, but I'll do my best to respond. I think as county officials, each one of us is tasked with following the law. If the law says that we can or cannot do something, that's what we have to do. If an interpretation of the law, which is a reasonable interpretation, is later overturned or reversed by a court, we need to follow what the court's ruling is on that law. So I think if there's a gray area, we have to do our best to follow the law as it's written, and I think that's what we do consistently. If there's a court ruling that says there was an overreach on anything in particular, then we shouldn't be following that direction anymore, and I think that's, again, pretty consistent with what we do. I don't know if that really answers your question, but that was my best attempt.
Supervisor Baker.
Well, I know we all took an oath to the Constitution, and I personally am going to look for that ultimate guidance over a statute interpretation by a bureaucrat in the state. Thank you.
Any other questions directed to Laura Scuderi? Seeing none, we'll move on. We're going to move on to 5B, resolution in opposition to COVID-19 mandates.
I make a motion to adopt resolution in opposition to COVID-19 mandates.
Is there a second?
Supervisor Krause, I'll second.
Second by Supervisor Krause. Questions? Supervisor Sandalski.
Thank you. I want to thank the supervisor that brought this resolution forward, and also I want to thank all the people that came to support it. Looking at the root causes here, I'm going to address the children and stuff here. Looking at the root causes of the recent uptick in the mental health crisis, the masks and all the COVID mandates have played a significant role. It's undeniable how the increase in mental health illness among children in the last 3 years. If we don't start addressing the root causes of our mental health, we're never going to reverse the trends. No matter how many therapists, counselors we have, we could hire 100, thousands. I mean, if they keep increasing, if we keep pushing mandates and doing things that hurt and harm the children, you're going to have things get worse and worse. So I fully support this, and I hope all the people on this committee will fully support it so that it can go to the full board. Thank you.
Thank you. Supervisor Marash.
Thank you, Chair. I will explain the reason that I'm bringing this resolution forward. In the past few weeks, I'm sure you've all noticed the fear campaign has begun in regards to masking and what's being dubbed as respiratory illness season. These reports are the reason I'm bringing this resolution to you today, and I'm hoping you will join me in my effort to protect the civil liberties of the residents of our county from another round of healthcare overreach. This is not meant to be political. COVID did not discriminate. We all were affected. This is meant to be prevention only, which was a question that was asked earlier today. We've all been enjoying the past year where most of our freedoms have been restored in regards to masks and vaccine mandates. But we must not forget what it was like at the height of the pandemic, where citizens were pitted against each other, and clearly, I guess we still are, which is very unfortunate. How the echo chamber of the mainstream media and celebrities with their approved propaganda campaigns filled the airwaves. Not to mention the pressure from the state and the federal government with their agencies such as the CDC, FDA, NIH, Big Tech, and Big Pharma, and we've since learned they're all in bed together. We must not forget how a group of people were vilified because they were not willing to sacrifice bodily autonomy without informed consent. Blank inserts accompanying the vials of vaccines would not suffice to prove safety and efficacy, and for that non-compliance, a second-class citizens was formed, who were demonized, bullied, harassed, and had their livelihoods jeopardized. And in the end, studies have proven that natural immunity wins out every time. How many employees and healthcare workers did the county lose at North Central Healthcare and Mount View Care Center during the pandemic? How many other healthcare workers have been lost in our clinics and hospitals due to the vaccine mandates and the lack of exemptions issued for health or religious reasons? How many small businesses had to close because they were considered non-essential, while Target, Walmart, and Sam's Club stayed open, just to name a few? How many people do you personally know that had to choose between their job and the jab? How many of you heard say, well, I didn't want to get it, but I had to because I needed to keep my job? How many regret it now and may have subsequently suffered serious adverse events or may have debilitating issues. Earlier this year, I requested information from the health department regarding the number of heart attacks, strokes, and people on permanent disability for the years of 2019, 2020, and 2021. Unfortunately, those numbers were unattainable. I requested that information because I wanted to know how Marathon County was faring in regards to mortality rates in these areas. Died suddenly is now a common description in obituaries, and one would think it would be prudent to find out the cause. Objective 3.3 in our strategic plan is to ensure every child makes it to adulthood with health, stability, education, and growth opportunities. We know from the 2022 annual report by the Marathon County Health Department published in May of 2023 that 29% of high school students and 27% of middle school students felt so sad or hopeless every day for 2 or more weeks in a row that they stopped doing some usual activities. Adults reported that 4.3 was the average number of days their mental health was not good in the past 30 days. 30.1% of adults feel like life is slipping out of control. 45% of high school students and 48% of middle school students reported feeling very anxious, nervous, tense, or scared like something bad was about to happen. Students experiencing significant problems with anxiety are 10 times more likely to report seriously considering suicide. As we heard again today, we just approved 6 new positions for the Children's Long-Term Support and Comprehensive Community Services programs because at that time we had 78 children on a wait list. I invite you to read an article I've included in the packet titled, 1 in 10 Kids Diagnosed with Developmental Disability. CDC says experts blame pandemic policy and rising numbers. Some examples of the damaging effects caused were delays in babies' physical development, babies struggling to crawl and communicate, delays in learning to walk and to talk, school closures, ineffective online learning, masking, and lack of socialization have caused the decline in normal childhood development, and due to school closures in the U.S., an estimated 24.2 million children have fallen behind in their learning by almost a year. A study in Nature found children aged 3 months to 3 years scored almost 2 standard deviations lower in proxy measurements of development, which is similar to IQ. A recent University College of London study on the outcomes of the United Kingdom government restrictions on children in 2020 to 2022 showed, quote, the impact of the pandemic will have detrimental consequences for children and young people in the short and long term, with many not yet visible. It will have continuing consequences for their future in terms of professional life trajectories, health lifestyles, mental well-being, educational opportunities, self-confidence, and more besides, end quote. Just because it's the UK, I don't see that there would be any difference between them and the United States. Clearly, what some feel about lockdowns, masking, and vaccine mandates being for the common good, this data shows otherwise. I've included several articles in the packet regarding the ineffectiveness of masks relative to preventing transmission or infection of viruses and COVID-19. One of them was the study by the NIH that Supervisor Sandelsky mentioned. These dangerous levels of toxic compounds are linked to seizures and cancer. The chemicals in these masks had 8 times the recommended safety limit of toxic volatile organic compounds. Inhaling these toxins has been linked to health issues such as headaches and nausea, and prolonged repeated use has been linked to organ damage and cancer. Other studies have found links to stillbirths, testicular dysfunction, and cognitive decline in children. On a positive note, the economy in Marathon County is just starting to show signs of recovery. McDevco is busy helping new businesses get started, and their entrepreneurial center is thriving. We are finding success filling vacant county staff positions, and we cannot afford to jeopardize these with another round of unnecessary mandates. We all have strong feelings about how the pandemic was handled and what we think may be in store for us in the future. I have included a plethora of publications in the packet for your perusal and have purposefully not cited from all of that documentation because the fact of the matter is you've already made up your minds. Either you are a critical thinker who searches for the truth supported by facts and data, or you're willing to believe the approved messaging from the CDC, FDA, NIH, WHO, and Big Pharma, who've had to been sued in order to tell the truth. In closing, I want to bring your attention to our overarching goal back here on the wall: to be the safest, healthiest, and most prosperous county in Wisconsin. In order to do that, we need to support the healthcare rights and freedoms of our citizens, and I ask you to please support this resolution so we can set an example for other counties to stand up and protect their residents too. Thank you.
Thank you, Stacy. Are there any other comments? Supervisor Lemmer.
Thank you, Madam Chair. The pandemic was rough, and many of the things that were just talked about, I don't even think science will uphold all of that. I think it's important to make sure we don't have correlation mistaken for causation. We had a brand new novel virus, and desperate times came for desperate measures, and now we have a toolbox that allows us to, I think, live more freely. This resolution I have concerns with. When I look at the very first whereas, number one, it's opinion, which I think doesn't belong in here, and I think it states that Marathon County Board of Supervisors supports the healthcare rights and freedoms of its residents. I think some people would take issue with all of the healthcare rights and freedoms that might encompass. When I look at number 3, that is also an opinion, and the articles that are used to support it do not fit the credibility requirement that I would have asked my 8th graders who were writing persuasive papers for me. Nope, you've got to look at the credibility and expertise and really dig deeper. And I would encourage you to do that. When I look at the 5th whereas, that also is very opinionated, and again, correlation, not causation. The 6th whereas, although factual, I would really enjoy hearing from maybe the health officer regarding if this resolution were to pass. I am the chair of the ADRC CW here in Marathon County, and I wonder what that would mean for our aging population and people living with disabilities, because my own dad is living with Parkinson's, and I've worked really hard over the last several years to try and protect him so I don't inadvertently give him this virus, which I've suffered from several times, actually. If we were to enact this, would this in any way stop our nursing homes or our hospitals from protecting our elderly and aging population? And then I may have a follow-up.
I think I can answer that question. I don't think this resolution would impact the ability of nursing homes or any entity in Marathon County from following whatever regulations are applicable to them.
Okay, thank you. And then just as a follow-up, the now therefore be it resolved does not specify COVID-19 as the title suggests. So I'm just curious if a reasonable person might be able to say, well, we don't need to do any masking for TB or any of the other communicable diseases that we may have, or let's say some of our newcomers who may or may not be vaccinated with some of the more childhood vaccinations, et cetera. How does that fit? It just seems to me there's an overreach in that now therefore be it resolved.
I can hopefully answer that question too. I read that as applying based on the whereas clauses in the title, specifically to COVID-19 mandates. However, if the committee or the board felt like clarification was in order, I think an amendment adding that specificity would be in order as well. So it would really depend on, I think as it reads now, I can see how there could be some ambiguity. So certainly that could be something the committee or the board could consider.
Thank you. Any other questions? Okay.
Thank you, Madam Chair. One of the reasons that I'm in favor of this resolution is over the past 3 years, when this all started, and anybody on this committee or staff know me, I'm a data-driven person, right? I like data. I wanted to research this inside and out. I've spent more than a semester's worth of hours in front of conferences with health experts and immunologists and respiratory doctors in person. And this resolution makes perfect sense with all the data that I've acquired in those conferences. I took a picture of a box of masks that we were required to wear for my place of business. And there's a warning on there. This product is an ear loop mask, just like the blue masks that we all wear, is not a respirator and will not provide any protection against COVID-19 coronavirus or other viruses or contaminants. That's right off the box of masks that we were required to wear for work. So that's a big reason that I'm in favor of this resolution. And the ambiguity of it, we can discuss at the full board, but right now I'm in favor of this resolution. Thank you.
Thank you. Any other questions? Anybody online? Okay, with this, we have a motion on the table and a second. Those who are in favor, say aye. Aye.
Aye.
Those opposed?
No.
Do we need to have a roll call? Or?
The chair can rule in the opinion of the chair that the ayes have it if that's the chair's ruling.
Okay, the ayes have it. So this will be pushed to the full board. Okay, moving on to 6, operational functions required by statute, ordinance, resolution, or policy. We have none today. Number 8, next meeting and date, time and announcements, and future agenda items. Committee members are asked to bring ideas for future discussion, and our next meeting is October 4th at 3 o'clock. And we're moving on to 9.
I'll make a motion to adjourn.
I will second.
Okay, Cavelli, motion to adjourn. Donna Krause, Second? All those in favor, say aye. Aye. Opposed? It stands.